All right, good afternoon, everyone. My name is Francesca Charles, and I work with our Insights team on our clinical reporting application or tools. I am a project manager and have been with CRISP for a little while now. So we're really excited to bring to you today our latest reports in the clinical reporting application, the diabetes prevention and control, as well as the skilled nursing facility length of stay reports. Before we dive into our demos today, I would like to just highlight that we do have a crisphealth.org / clinical reporting landing page. If you are interested in receiving an overview of the tool, some of the key features that are available within the existing dashboards. If you are looking for one-pagers, you can find them in our documentation section, as well as a quick FAQ guide that has some answers, questions and answers regarding access to the reports and the clinical reporting application. We have a list of available reports, which we will update as we continue to add reports to the suite of clinical reports, and some pre-recorded webinars and videos for your review. Please feel free to visit the portal at your leisure, and feel free to reach out with any questions regarding access and reports. That said, we'll move into our portal demo for today. So before we jump directly into the dashboard, I do want to highlight that in order for a user to access the clinical reporting application, it is a requirement that the user has an HIE portal account created. Once the user has an HIE portal account created in the HIE admin tool, the organization's CRS POC or reports role manager POC is able to then credential the user with the existing clinical reports. The Within the HIE admin tool, the clinical reporting tools is an application that is assignable. And so please feel free to contact your HIE admin and or CRS reports role manager POC in order to receive access to clinical reporting tools. If you have any questions throughout the demo, please feel free to drop them in the chat, and we will try to answer at the end of today's demo. All right, I have navigated over to our stage environment. By selecting the clinical reporting tools, what we'll see is a list of available reports. Our dashboards will soon be updated, and so the look and feel of the UI will be completely different in just a few weeks. So really excited for that. We'll start today with the diabetes prevention and control dashboard. So this report really provides an interactive view of diabetes prevalence. It does offer users the opportunity to monitor specific labs, such as A1C, eGFR, UACR. We'll dive into those a little bit later. It does offer the ability to review any diabetes-related comorbidities across the patient population that you are reviewing or analyzing. The tool is designed to support population health management and any quality improvement initiatives your organization and your team would like to put into place. The dashboard looks at any potential care gaps that may be um, that may exist within the population, and it allows you to, of course, evaluate um, your patient population through some of the demographic categories that we're seeing here. Consistent with all of our existing reports, at the very top, we have a last refresh date that displays the most recent data refresh date. The, this particular report is refreshed daily, and it does include a 2-year look back from the current date. The following button at the top is the panel selection, where users will have the ability to navigate between panels that they are provisioned and authorized to access at their organization. The clear all filters resets all drop-down filters that have been applied within the report. It does not reset any filtering that might have been applied within the dashboard. So, for example, if I were to select one of the bars within one of the charts, in order for me to return back to the default state, I would have to click within the actual chart again to clear that specific filtering. The notes and documentation button offers just some general definitions and guidance on how to navigate through the dashboards, through the report. So for users who aren't familiar with using Power BI dashboards, this is a very useful tool within the report for navigation. And again, as I mentioned, in terms of definitions and logic that are being applied within the dashboards, the notes and documentation button will provide additional context. To navigate back to the report, you can select the Back to Report Click Here button at the very top. If you were to select the Close button at the very bottom, that will take you back to the main dashboard where we saw the blue tiles with all of the available reports. So for today, we'll select Back to Report, and that will take us back into the dashboard. For the diabetes report, we are looking at the first 4 static cards here. Static meaning that I can select, I can click, and the data will not change or update. So we do have patient count, lab count, the percent of patients with diabetes, and the patients or the percentage of patients with labs. Just a quick note before we dive into the filters. So all filters can be individually utilized. So if you want to specifically select a comorbidity, you can do so, and that will update dynamically the rest of the charts. Or you are able to select multiple filters. You can submit or create a combination, utilize the reports in combination in order for you to fine tune the data set and create a targeted population view within the report. So again, the filters can be used individually or in combination to refine the report. Many of the charts are interactive, as you can see, so selecting any value within the actual charts does update the subsequent charts and static cards within the report. A question that we receive very often is where we're receiving the data, where's the data sourced? So all of the data that is displayed within the clinical reporting app are sourced directly from the participating organizations that are sharing patient panels, any ADTs, which are admissions, discharges, and transfers, CCDs, the continuity of care documents, lab values, and any referrals, depending on the dashboard that you are accessing. So the completeness and timeliness of data does vary by organization, and the reports do reflect the data that's actually available. So if something is not present, if the total counts aren't as you would expect, it may be that it is just not representing the entire full population at the time, and you can always get in contact with us for us to take a look at your panel. We do have some exclusions in the data, such as any opt-outs or any 42 CFR Part 2 data will be excluded from the reports. So as I mentioned earlier, we are looking at the total patient count um, in the patient panel. On the patient panel, the total individuals that have labs, the percentage of patients on the panel that have been diagnosed with diabetes, and the percent of patients with labs. The filters that are available for this dashboard are the comorbidity related to diabetes, any practice, PCP, diabetes status, and just to provide the listing, we're looking at diabetic, not diabetic, and pre-diabetic. That is also reflected here in this initial chart. The time period filter allows for the data to be parsed within 3 months, 6 months, 12 months, and 24 months. Race, of course, we have the race categories you're able to select, ethnicity, gender, the diabetes type, not diabetic, pre-diabetic, type 1, type 2 diabetes, and an age range. So specifically, if you'd like to look for individuals within the range of 25 to 55, you can easily enter the range, or you can utilize the slider if that's easier for you. All right. Our first chart, pretty self-explanatory. What we're looking at here is the total count of users, or excuse me, not users, but patients. We can see over on the left-hand side panel of this chart that we are looking at patient count by the diabetes status. So very clearly in this table here, we can see that we have 1,056 patients that are not diabetic. The total count here of patients who have been diagnosed as diabetic is 55 and pre-diabetic as 25. If I failed to mention this, this is all demo data. So if the total counts aren't adding up for you, it is because this is not real patient information. This is not a real panel. The diabetes type is also displayed in the following chart with the total patient count, which you're able to hover over, and you'll have a card that pops up to help you see that a bit more clearly. And type 2 diabetes count, the pre-diabetic count, and the type 1 diabetes count. So very quickly, you're able to identify where the patients fall in and within each of the categories, allowing for more targeted care interventions. And again, if you were to apply any of the filters at the top, let's say you wanted to identify the African American population for diabetes and the total count within this particular population, you can see we have 187 that have been that are not diabetic, 10 who are, and 3 that fall in the pre-diabetic category. And in terms of type, within that 187 or the total count of 10 that's diabetic, you can see that there are 9 that are type 2, 3 that are pre-diabetic, and 1 that falls under the type 1 diabetes type. So that is a very quick um, analysis of a specific group of patients. It does provide you with the patient count, how many of those individuals have the lab value uh, shared with CRISP, the percentage of the population that this group represents, and the patients with the percentage of labs in total. So I will utilize our clear all filters to clear the filters and revert us back to our default. Our next chart is a very unique chart. I like this chart. The diabetes status by demographic. And so the the example that I just walked us through by selecting the race category is easily displayed here in this chart. By hovering over, you can see the representation of the specific race, the total count of individuals, and uh, the the legend over on our right here is providing us with the status. So we have diabetic, not diabetic in gray, and orange for the pre-diabetic. And so you can easily hover over this specific area in the chart to see the race as well as the status and the total patient count that falls within the specific category. So um, extremely insightful and allows users to make informed decisions about their population. The filter within this chart does allow for navigation between race, ethnicity, gender, and practice. And so you're able to stratify the data to see the total counts again across the various categories that are available within this drop down. So within this one chart, you're able to have a better understanding or gain a better perspective of the population looking at race, ethnicity, gender, practice by diabetes status, and total counts within the population. Our next set of charts, we are looking at lab results range by lab type, another very unique chart here where we do have the result ranges for each of the labs, color coded or within this legend easily again for you to be able to identify the total number of patients falling within the category and as well as the result range. And so here you can see in this card, we're looking at the status of not diabetic. The result range is 7 to 7.9, and the patient count is 6. If we were to hover over the diabetic total, we would see again the result ranges, the total patient count, and the status. The lab type filter allows for you to navigate to the various lab types that we are pulling in for this particular report. So we're looking at EGFR and UACR, looking at the abnormal or any high risk lab values where you're able to evaluate disease control and prioritize any patients who may benefit from interventions. Or you may also select within the specific area. And again, all of the other charts will automatically update dynamically You can scroll down to the very bottom, and I know I'm getting ahead of myself, but see that exact population for the range that you've selected. And UACR will provide you with the range at the top, color-coded by the diabetes status. Lab completion rates. This particular pie chart displays the percentage of patients with completed lab tests. So similar to the total count of labs that we've received and the patients with labs at the very top. This chart breaks it down for you by lab type. And so if you wanted to see how many patients have their A1Cs completed, you can see that as well within the percentage and the time period, all color coded. So 3 months would be the blue, 6 months the gray, 12 months the darker orange, and 24 months the more goldish yellow orange. Also, once hovered over, you're able to see the total patient count and the percentage um, that this particular group represents from the total population. A great chart to see if there aren't enough labs being shared with CRISP for the patient population, gives an opportunity for organizations to partner with account managers to see how we can increase the total lab values being shared. In terms of diabetes related comorbidities, again, these are being pulled directly from data that have been sourced from our ADTs and CCDs. And so here you're able to see, again, the total patient count by the comorbidities that have come through. You can see here we're looking at cardiovascular, obesity, hypertension, again, all comorbidities related to and with patients with diabetes, retinopathy, and any chronic kidney disease stages. So hovering over, you are able to see the total patient count as listed above the bar chart. But if you were to select that specific area, the 16 patients would populate in the table below and allowing for targeted outreach, care coordination, and specific interventions for that population. At the bottom of this dashboard, we have a few more filters available to you for you to look at observation dates. So the date range, again, you're able to select. You can also use the calendar functionality and select the specific date range you're interested in to filter out the patient population. The lab table field filter allows for you to, let's say you'd like to look specifically at the patient ID. You're not so interested in, let's say, race or ethnicity, but you are interested in the diabetes type. So you are dynamically able to manipulate this table to fit the specific categories you're interested in looking at. What's really neat about the patient details table in all of our reports is that you are able to hover at the very top of the patient details table, select the three ellipses and export the data into an Excel spreadsheet. You do have the ability to select the current view or a summarized version of that. And once you've export, this will give you an Excel spreadsheet that you're able to quickly filter and manipulate and design your own Excel charts as you see fit. So the lab table fields allows you to uh, determine which columns you'd like to see. And as you can see within the table, you do have the ability to compare and see the various results and labs that are being pulled in. And so again, if you're looking for individuals that should have had a UACR or a GFR, and you're noticing that there is missing data in the chart, it's possible the the labs have not been completed or the data is just not being shared with CRISP. The lab data availability allows for you to select patients with labs specifically, and again, you'll filter that out. The lab type range allows for you to select the various ranges within the table. So if you wanted to specifically target individuals with less than 5.7 of a range, you're able to do so and identify the non-diabetic patients. Or if you're looking for the high risk, we can do the complete opposite and look for individuals with that 8 to 9 or 7 to 9 range and conduct outreach to these individuals. You can also export and share the list with um, other care providers within your network, just your case managers, for example, if they are allowed to provide treatment for patients or any data regarding their lab results, that can also be utilized. In terms of the time period filter, again, you have the ability to filter out the table for 3 months, 6 months, 12 months, and 24 months. All right. That is our diabetes prevention and control dashboard. I will close this report and navigate to our skilled nursing facility length of stay report. Another report that we are really excited to bring to the dashboard. The skilled nursing facility length of stay, or LOS, dashboard is also interactive and it provides a view of post-acute care utilization, allowing for organizations to analyze the, I like to say activity, but really encounters following any hospital discharge, any SNF related admissions following a discharge. So at the very top, similar to the previous report, you do have the last refresh date, the panel selection drop down, a clear all filters, and the notes and documentation that is there for your review. The static cards, we have the total patient count, the median SNF length of stay day, the initial visits uh, count, so total number of days of initial visits, and the total SNF visit count. In terms of filters, we are able to filter by initial hospital, the SNF, any overlapping hospital stays. For overlapping hospitals stays, those are stays that occur after the patient has been admitted to a SNF and is returning to a hospital. The age group, the gender, race, and ethnicity, and we have a program filter. This program filter, it will show no program if on your patient panel you are not sharing program as a data point that we can parse and pull into the reports. And so if it shows up as no program, it's because the patient panel does not contain that data. Next, we have the SNF LOS. If you'd like to have program considered, you are able to update your patient panel and share that with Chris. The SNF length of stay, we opted to limit it down to 99 or 100 days. If, of course, we're unable to determine if a beneficiary resides at the SNF. However, that's easily deduced based on the total count of days and outreach conducted by the organization. And so similar to the previous report, any sliders can easily be utilized to leverage or update the, the total length of stay count, or you can easily enter the total if you're looking for individuals that have stayed for 55 days or above, or if you're looking for that 1 or 0, I'll say 0 to 30 days mark, you're able to enter and filter the data as such. We'll use the clear all filters, and that will set us back to our default. You're able to filter by the initial hospital length of stay, the SNF discharge date, again, similar to the observation date, you're able to leverage the calendar functionality and select your specific date range or utilize the slider. And we are looking at the comorbidities that are most prevalent within the patient population. And here you're able to, again, filter for specific individuals at the SNF stays with specific chronic conditions. Very interesting dashboard. Our first chart looks at the median length of stay by month and year. And so if you're tracking trends for SNFs, you're able to utilize this to see where you've had some peaks and some lows, what time of the year particularly had the highest length of stay, uh, and who those patients are that stayed within that particular period. So you're again able to monitor any changes in the median LOS with time and identify the trends for post-acute care. The chart next to it looks at the total SNF visits by month and year. Again, if you're looking to see what period of time, you can compare 2024 with 2025, 2025 with 2026 in this particular chart, and see if there's been any improvements in either reducing or if any interventions were implemented during a specific time period within the year. Are you seeing any changes in discharges and any relations to SNF stays? The median length of stay by SNF, if you are looking at the total number of visit counts by SNF and the length of stay, you're easily able to determine which SNFs have had um, the highest counts of visit stays, which have the lowest, and you're easily able again to select within the chart and compare that with the initial hospital visit number at the very bottom, uh, directly below, rather, directly below the chart to see which hospital is driving the, the total number of SNF length of stays. So the two charts really go hand in hand if you're looking to conduct that level of analysis for the patient population. The following chart looks at, I always want to remind myself to go back to our default state. The following chart looks at the number of SNF visits by duration. Again, just by hovering over, you're able to see the total number of days by the total number of visits. And so we've had 164 visits that lasted, or individuals stayed at the SNF for 23 days. Again, a total count of 109, excuse me, with duration of 40 days, and so on. And in terms of chronic conditions, you're able to see the total patient count within the chronic condition category. If you're interested, again, you can utilize, let's say you're interested in looking at the breakdown of the patient population with hyperlipidemia. If you were to select the hyperlipidemia, we would be able to see the total count of patients with this specific chronic condition, their length of stay. We would be able to determine which initial hospital visits, or which hospitals, the median length of stay for said population, and the trends for the patients as well, and the total counts at the very top. So using the charts and the filters in combination can provide additional insights. And at the very bottom, our patient details table looks at the patient ID, the initial hospital by patient class, the initial hospital name, initial hospital admit date, as well as the discharge date and the diagnoses from the initial hospital visit. If there was a SNF stay, there will be the name of the SNF, the admit date, the discharge date, the total length of stay for that particular encounter, the discharge disposition, if shared, and if the patient, of course, was discharged from the SNF, this will be populated. Any overlapping hospital stays, we're also capturing that in this table so that you're able to cross-reference any overlapping or encounters that occurred during the patient's stay, the admit date for the overlapping hospital, as well as the discharge date. All right. Final thoughts for the dashboards. Again, leveraging the filters and the charts will help you better create that targeted outreach for your patient population and develop the interventions that are required to provide and improve care outcomes for the beneficiaries. That is the goal for all of our reports, is to provide you with the insights and the tools, the total counts and percentages that are available for your patient population in order to allow you to make the informed decisions for you to provide better care. And that is all for today. So I will stop sharing. This recording will be made available after this session. You will be able to access it on the landing page for clinical reporting. If you have any questions, please do not hesitate to reach out. Thank you so very much for attending today's session. Have a wonderful day.